I'm Diane Roberts Ayers, and I am a public health advisor in the Division of Nutrition, Physical Activity, and Obesity at the Centers for Disease Control and Prevention. I've been with the CDC since 2009. I really love my work there. I've been in lactation for 25 plus years. I've been working in the local level, state level, and now the federal level. And I started in lactation working for the city of Detroit. And I worked in the WIC program. And when I came back from maternity leave in 1990, WIC had just received all this funding to do breastfeeding promotion. So when I came back, they said, well, aren't you breastfeeding? I said, yes. I said, okay, you're the breastfeeding coordinator. So what's sad about that is there were probably about 18 to 20 nutritionists, people who are experts in the field of nutrition. And not all of them were mothers, but all those that were mothers, there was only one other person who had breastfed, just 25 years ago. So that doesn't say much for the field, but a lot has changed since then. I see a lot, even within the field of dietetics, that there is a lot more acceptance of breastfeeding. And of course, for WIC, we see a great deal. We did a great deal of work, and I'm really proud of the work that we did in WIC. So just wanted to let you know that breastfeeding is really important to me. It is something that really has been near and dear to my heart. When I came back, I just breastfed because I just knew that that was what I wanted to do and what I was supposed to do. And I'm from Southern California, so that was really acceptable. So even though I was in an environment that wasn't as accepting, I just did what I knew I wanted to do. So the work has been really important to me. And, you know, I did a lot of studying to really get the research and the background of breastfeeding and understand everything that was going on. So we know that breastfeeding is associated with a lot of health benefits. Breastfed infants have fewer infections during infancy and are less likely to develop chronic diseases. Breast milk can save the life of a premature infant. And women who breastfeed have a reduced risk of uterine cancer, diabetes, and cardiovascular diseases. These amazing health benefits, we could not design a public health intervention to do all this. That is why breastfeeding is a public health priority and a CDC priority. So there are many federal documents and policies that call for increased support for breastfeeding, including the 2011 Surgeon General's Call to Action to support breastfeeding in the United States, and I'm sure many of you are familiar with it. In responding to the actions called for by the Surgeon General, the CDC Guide to Breastfeeding Strategies to Support Breastfeeding Mothers and Babies outlines a number of strategies to guide public health professionals and breastfeeding advocates in developing interventions to increase support for breastfeeding mothers. So we have here the breastfeeding socio-ecological model. And the interventions called in the CDC guide are meant to influence factors at many levels of the socio-ecological model to create environments that support a mother in her decision to breastfeed. So mothers need support during the prenatal period, the hospital stay, when returning to work, and at various places in their community. So starting with the mother and baby at the center of the model, each circle of influence represents an opportunity where a mom can be supported. Starting with the spear closest to the mother and baby, that's the family and friends, and extending all the way out to the most distance where we have non-federal organizations and federal organizations. They all play a critical role in supporting breastfeeding. By supporting moms at all levels, mothers are more likely to meet their personal goals to breastfeed and to continue breastfeeding. CDC provides resources for state and local health departments, community-based organizations, and hospitals to implement breastfeeding support activities. The breastfeeding support efforts of CDC, in combination with the efforts of many agencies, organizations, and individuals across the United States, have contributed to increased breastfeeding in the United States. The most recent data show that 80% of infants start breastfeeding, and just over half of infants are breastfeeding at 6 months. This is great progress. Whoop. Excuse me. This is great progress considering that 20 years earlier, only about 55% of infants started breastfeeding and less than 20% were breastfeeding at 6 months. In short, there's been progress on breastfeeding because of every one of us working together to support mothers and babies. Now, while it is encouraging that overall about 80% of the infants now start out breastfeeding, we know that social and socioeconomic disparities in breastfeeding persist. Here we show the black-white racial disparity in breastfeeding in the United States. While some progress has been made in narrowing racial disparities, far fewer black infants start breastfeeding and are breastfeeding at 6 months compared to white infants. As a result, far fewer African American infants and their mothers will benefit from the health-promoting properties of breast milk. Health equity is a CDC priority, and achieving equity in access to breastfeeding support is a CDC priority. So CDC focuses its work on supporting breastfeeding through 3 main strategies: improving hospital support for breastfeeding, implementing worksite support for breastfeeding, and increasing access to lactation care providers in the community. And to improve equity and access to breastfeeding support, we prioritize our funding to support hospitals and communities serving populations with lower breastfeeding rates. In selecting hospitals to assist in implementing the 10 steps to successful breastfeeding, we prioritize funding to hospitals serving a higher proportion of African American women and women with Medicaid coverage. In increasing access to peer and professional support in the community, we prioritize funding to local health departments in the vicinity of select hospitals working on the 10 steps, and we prioritize the funds to community-based organizations in communities with a higher proportion of African American women and women with limited resources. In assisting state health departments with the implementation of worksite lactation support, we specify implementation of the Affordable Care Act provisions for hourly wage earners. So in the map here, we show that for the first time ever, CDC has been able to provide funds to all 50 states and Washington, D.C. to support breastfeeding. Yay! No easy feat. So we've done this through 2 funding mechanisms. So there's 32 states that have enhanced funding through our 1305 cooperative agreement to work on improving hospital support, implementing worksite support, and or increasing access to lactation care providers in the community. And they can choose one of those strategies or all 3, but they have to do at least one. In the 19 states and District of Columbia, they receive funding through our cooperative agreement with the Association of State and Territorial Health Officials to carry out the exact same priorities. On the map, you also see that there's stars, and those represent the 65 community organizations receiving the National Association of County and Health Officials funding to increase access to lactation care providers in the community. And you also see the yellow dots are the Empower hospitals, and those Empower hospitals were also focused on communities where there was lower breastfeeding rates. So I do want to mention that all of this work has a major focus on health equity. We have a good understanding of which populations groups are at highest risk of not breastfeeding. And our funds require that priority be given to addressing these disparities by increasing access to breastfeeding support. Our current work with NACHO, which is the National Association of County and City Health Officials, is producing lessons learned on how best to provide community support for the 4th trimester, as well as to how best to help communities identify targeted approaches that will work well in their community. And we're looking forward to the opportunity to share and disseminate their final reports so their success can be replicated. Finally, just want to thank you for the work that you're doing to support breastfeeding and your commitment to breastfeeding. The CDC looks forward to our combined efforts in achieving health equity in breastfeeding. Thank you.